Hello and welcome to today's presentation. Our topic for today is communication. My name is Miriam Mukasa, and this presentation was prepared in jointly with Kamaile Tripp-Harris, who is a community health worker. So for today, we are going to look at our objective is to, these 5 things, which I hope by the end of the presentation you will have gotten. So our first one is to identify key components of effective communication, and this includes the verbal and the non-verbal skills. I want us to, understand active listening, what empathetic communication skills look like. And number 3, we will, learn how to use appropriate communication, including the spoken and written communication. Then we'll practice a little bit on how to handle difficult conversations and to navigate the barriers that show up in communication. And finally, I would like for you to learn how to connect clients to the relevant materials that they need. All right, let's jump right. So for this, we're going to start with just the definitions of communication, and then in the next parts, we're going to get more hands-on on what that means. So bear with me. Let's just do some definitions here. So what is communication? Here I used a definition from the Utah Community Health Workers Association, and they define communication as the process of exchanging information, ideas, and messages between individuals or groups. Within communication, we have active listening, and this is paying attention to other people's perspectives and their needs. Effective speaking, which is also part of communication, is the ability to communicate clearly and concisely, both verbally and in writing. Within communication, we have, emotions of sympathy and empathy. Well, sympathy is the feelings of pity and sorrow for someone else's misfortune, while empathy is the ability to understand and show the feelings of others. So we'll be, sprinkling this along the way, but hold those definitions in mind. And then we have nonverbal communication and being able to understand the nonverbal cues that enhance communication. They are actually a huge part of communication. All right, let's dive right in. So why is all this important to begin with? Why is it important for you as community health workers? So the Utah legislature defines the Utah legislature of 2025. They do give a definition of who a community health worker is, and you act as an intermediary between the community and health services or social services. So you're kind of in between and those two, and your role is very vital to the communication is an essential part of that because it helps you build trust between the clients and the patients, the clients or the patients, to make sure that there's clear health education. So you play a very pivotal role in that. So it's really important for effective communication to be clear, concise, and so that it's easily understood and it leads to the desired outcomes. So again, it involves both verbal, that is the spoken or written words, as well as the non-verbal, the body language, facial expressions, and whatnot. So within communication, just diving right in what it looks like. On the right, I have a picture of, with a sender, initiating a message and the receiver receiving that message. Here it seems simple, but believe me, there's a lot of breakdown that happens in that process. So we'll start with the sender initiating the message. So, when the sender does initiate the message, the receiver, sometimes it's not automatic that the receiver just gets the information and moves on. The receiver needs to accept the message. They need to provide feedback, confirmation that they received the message. So here's the very first point where there's a breakdown in communication. The receiver oftentimes is not aware. My apologies. The sender is not aware that the receiver did not get the communication. Actually, both sides are usually not aware, and they might misunderstand something. So in order to prevent that, we both don't know if we've understood each other, I have on the right what they call closed loop communication. And here the sender, there's a component of the sender verifying that this message was received. So when I do send the message, for example, it might be, oh, can you please, telling your partner, can you please pick up some milk on your way back home? Pick up some milk from the grocery store on your way back home. So when you do send this message, very, very fast check-in of making sure that the message was received is getting some kind of confirmation, some kind of acknowledgement that this message was received. I could be telling my partner this message and they have their earbuds on and listening to something and they don't hear it, and I assume they've heard it. So that confirmation could be something like yes, some affirmation, or yes, okay, something that shows me that you've received the message. But still, we do have breakdown in communication even at that. So in this, for example, in this example, my partner says yes, and maybe I am talking to them, and they are in the middle of, let's say, a phone conversation, or they have their earbuds on, they're in a phone conversation, and they do say yes to the other person on the line, and I think they've said yes to me. So you can see how clearly there's a breakdown there. So in this part, some of the, which leads us to kind of the also the verbal communication and the non-verbal cues, is that I should be able to pick up that, oh, maybe his back is, my partner's back is facing me, and so he has earbuds in, and I say, please pick up some milk on your way back home, and he says yes, but he's saying yes to the phone. So one way of seeing that is being able to recognize that his nonverbal body language is showing me that he's not with me. So, eye contact is important to make sure that someone, that communication is being received. So again, you as a sender, there's a responsibility that comes with initiating the message and what that looks like. So, but then another way, the receiver, to ensure that, closing the loop. So we initiate the message, and then we need to make sure that the message was received, that the receiver accepts it and provides feedback confirmation. So if my partner says, if I ask, may you please pick up some milk on your way back home? And he says, yeah, sure, I'll get some milk from Smith's on my way home. That confirms that they've received the message. They know when I want the milk, so that is, a lot. It seems very simple, but right there's a lot of breakdown. And when the breakdown happens, it's hard. There's no one is at fault, because both of you understood different things. And so we're going to be circling back to the closed loop communication, because we're going to be using it a lot. So think about, even your own private, personal life, but also professionally as a community health worker, how you can close the loop in those communications, how you can, make sure that the receiver accepts the message and they provide feedback that the message was received. So there are, many aspects when we started, many definitions, but I came up with like a simple like acronym to help us remember the important things in communication and the key elements of communication. And these are like the ABCEs of communication. So the very first one is active listening, body language, that nonverbal communication, the culture, competence, making sure you have clarity and conciseness as well as empathy. So we're going to dive into what that means, but then again, what it also looks like in communication. So active listening, here it's the ability to actively listen and understand someone else's perspective. Here you're engaging fully using your words, your tone, and your body language. So things that are helpful that help someone know that you're actively listening is when you summarize what someone has said. So going back to the example, maybe my partner saying, do you want just milk? Would you like me to pick up some eggs as well? Kind of like, so that's kind of summarizing, but also I'm diving into the asking clarifying questions. So him telling me back that, do you want me to pick up just milk, makes me know that yes, he does want what exactly he wants. But then when he asks me a clarifying question, that lets me know that he really was listening to me and understanding what I need. So when um when he asks me if he wants, do you want me to pick you up some eggs or something else, that's a clarifying question. And then, nonverbal cues, for example, when I do present that request, if he, nonverbal cues that, look at me, nodding, maintaining eye contact that I talked about, this helps me to understand, to demonstrate understanding as well as to encourage an open dialogue. So thinking about your work with clients within the community, how do you show them that you're actively listening? Are you, when they do tell you something about their experiences, are you summarizing that? Are you making sure that you understand them fully? Are your non-verbal cues also communicating that? So beyond active listening, we have something called reflective listening that helps us to deeper understand the clients that we're going to be working with. And within this, we, rephrase the speaker's words to highlight the emotions and underlying concerns. So what does this mean? So, the active listening, we're kind of just making sure that you're actually just hearing what I'm saying. Like with the example with the milk, you heard me to say, oh, please get me some milk, like making sure that you actually heard what I said. But beyond that, for conversations that are deeper, we need to have a reflective listening skills. And within these skills, you're able to convey the deeper emotion that someone is trying to highlight. So, for example, someone is telling you a story about how a colleague, a work colleague, they helped out, a month ago when they needed a favor. They helped and switch their schedule to accommodate them. But here you are now, you wanted the work colleague to switch out their schedule to accommodate you now, but they refused. And so this person is telling you about this whole experience. So reflective listening is being able to pause and reflect and say something like, it sounds like you were hurt by your colleague not being able to reciprocate the favor. So kind of like picking up on the deeper emotions, or highlight the emotions and the underlying concerns with what they're saying. So they're saying something, but the reflective is you being able to, gather what they're saying. And also, validating their feelings, or, someone might say, in that example, someone might point out that, I was hurt that they couldn't help me when I asked them. So validating that and saying something like, I would understand how that makes sense why you would be hurt. I would be hurt too in such a situation. So, validating their feelings, and then, encouraging self-exploration without offering unsolicited opinions or solutions. Our go-to is, for most of us, for myself, is to initially just, offer opinions or solutions when someone gives you a problem. And that, refraining from jumping into that, but instead kind of using open-ended questions to let the person come up with their own solutions and their own, um, information or support. For example, if someone has given you, telling you about such a situation, and instead of, um, maybe something's not working, and things are not going well. For example, with the example with, let's go back to my example of the work colleague, and maybe they have something coming up. My child's birthday party is coming up this weekend, and I really needed to switch with my colleagues so that they work my weekend so that I can be there for my child's birthday party, something like that. And so instead of asking, offering a solution, or did you try talking to your supervisor, or did you try this, instead of you coming up to with that, I know that intuitively we want to jump into that, but pausing and taking a step back and asking open-ended questions that, ask, what have you tried to do to resolve this? What have you tried to do? So that question kind of, or even just rephrasing, it sounds like you've been trying a lot of things. You've been trying to change your schedule with your colleague. What else have you tried, or to resolve this? So it's a it's another way to show reflective listening and helping the person to self-explore without, offering unsolicited opinions or solutions. So when a message is not clearly conveyed, or it's misunderstood, or it fails to achieve its intended purpose, this is what we refer to as non-effective communication. And, non-effective communication has many characteristics. I highlighted some of them here. It is not clear, it's vague, it's ambiguous, or sometimes uses very complex language. And within this, when communication goes awry, usually there's like poor listening skills, someone wasn't listening, or sometimes it's inconsistent messaging. Someone tells you something, mixed signals, they tell you something today and then they change it up, say something else, and then now you're confused. That's, all non-effective communication. Then failure to provide feedback, that going back to that closed loop that we talked about, being able to provide feedback that you have received the communication, and that goes both written and verbal. And then negative body language, someone just showing you that they're not interested in what you're saying. If you've ever talked to someone who really doesn't want to talk to you, sometimes they don't need to even say that they don't want to talk to you, but you can pick it up from their body language, like someone just, folding their arms, looking down, and that kind of, that shows you that they don't want to talk to you. And so sometimes we might inadvertently communicate that with people when we're not aware. Our body language and how, that shows up as open, what we do with our body that shows other people that we want to talk to them. And then there are also language and culture barriers that show up. So using language or slang that is unfamiliar to the audience. So, especially when you're working with an audience, culture, or people who speak another language, those can really be barriers to communication. I recently went to a high school, and there was a lot of slang that was used that I had to catch up on, and be, I had to ask what certain words that were used were. And so, being able to, we're going to cover that, in terms of how to then help yourself in cultures that you're not familiar. Well, that's my example is a smaller thing to deal with, but if you're dealing with people who English is not their first language or they're not very familiar with English, and how to make sure that you effectively communicate. But going back to the closed loop, even in all of the above situations, um, making sure you close the loop. You're making sure that the sender has understood, the receiver has understood the message and has confirmed with you that they've understood that. So let's dive into some examples of what this looks like. So a poor communication is someone telling you, oh, you need to handle this task soon. That is very vague and clear because, soon is very subjective. My soon can be tomorrow. Another person's soon can be in the next hour. Another person could be in the next 2-3 days. So effective communication would be telling someone, please complete this task by Friday. And then not only that, but also giving me an action task of what to do once it's done. Email me once it's done, or put it on my desk once it's done. So being clear, specific, and includes an action this is very good communication. So think about your own communication as you're working with people in the community. What are you saying to them, and how is it clear? Is it or is it vague? Does it include an action? But we're gonna go into a little bit more of some of the things to help you with communication. So here's another example of non-effective communication. So let's say you're out there in your community and you're trying to get someone to take their medication more regularly. And so you say something like, you should take your medicine regularly, otherwise your condition might get worse. Now we all know this. It makes sense. But why would this communication be ineffective? So, if you can pause and before you read the slide, pause and reflect on why that's not clear, and then take a moment to come back and reflect. So, this communication is ineffective because to you, regularly makes sense because, you're thinking regularly is daily or, according to whatever the prescription is, but to the person it's unclear. Does that mean daily, twice a day, or when the symptoms appear? And then there's no explanation of why I need to take this medication. Let's say I get an occasional headache. Why would I then need to be taking this medication daily? There's a discrepancy right there. I don't understand why I should take this medicine regularly. And then also, there's no closing that loop. Remember, we're going back to the loop. The health worker, did not check to understand if the patient or the client understood or has any concerns. So you go away thinking, oh, I checked with the community, I helped them adhere to their medication, but the reality is that this medication you did not check back that closed loop to make sure that they received the information they understood. So let's look at what we could do better to help that be clearer. So a better approach would have been to say something like, you need to take this medication every morning at 8 a.m. and every evening at 8 p.m. Taking it at the same time each day helps control your condition and to prevent complications. If you miss a dose, take it as soon as you remember, unless it's close to your next dose. Do you have any questions or concerns about this? So here you can see, it's clear what time, regularly is. Like it's clear that it's 8 a.m. and 8 p.m. daily. And then it explains why this is important, helping me control the condition and prevent complications. And then engagement, here you're closing the loop. You're checking in with the client. Do you have any questions or concerns about this? And here then you will be able to, it opens up the floor to, the challenges the person might have in taking this medication, or maybe something they haven't understood, or maybe by 8 a.m. I am already at work and I'm not able to go with the medication. So um, can I take it earlier? So it helps you to close the loop and make sure the receiver tells you any issues that might come up and that you can then navigate together. So this is what effective communication looks like. All right, let's dive into difficult dialogues. So sometimes we do have conversations that can be sensitive or emotionally charged, and they lead to discomfort, tension, conflict. And these, we need to be real careful how we navigate this so that we still remain mutually respectful and understanding to those that, do not have the same opinion that we do have. So, some of the examples here are like, talking to a patient about a terminal illness, that can be really tough to navigate. Addressing vaccine hesitancy or mistrust, medical mistrust in a community, or helping a family navigate end of life decisions for a loved one. So, those can all be very difficult conversations to engage, and sometimes we might feel like we don't know exactly what to do in these situations. But these are just some tips to help you have some tools in your toolkit into to know how to handle these types of situations. So the first thing when you're handling these difficult situations is to first know your audience, understand their concerns. It's very easy to dive in and offer an opinion you know, and dive in and state something or a fact that you know for sure, but that's not going to help you relate to your audience. So know your audience, understand their concerns. If someone shows up and they're saying, I'll give an example of we had children that we had families we were working with who were living with HIV, and we were conducting a study to help them. We're doing research, um, helping them to increase their ability to take medication. However, some of the children were not taking their medication, and as prescribed, they were skipping multiple days. And so instead of just coming in and, and they were getting worse in their health, and instead of just coming in and stating the obvious of you should definitely take your medication, no, that wasn't the approach there. You need to come in with a stance of understanding what exactly is going on. So when we dug in deeper to understand and ask the questions, it turns out that these children were, their medication made them hungry and increased their appetite, and unfortunately they were living in limited resource communities and they couldn't access food, and so rather than being hungry they skipped their medication. So when you understand the audience, you understand their concerns, you will then be able to help them better, and also to have those conversations. Then educate yourself on the mistrust and the historical context of the people you're working with. If someone has mistrust with the healthcare, understand what happened, understand their history, understand where this came from. This can then help you identify how to move forward and how to help them. And then most importantly, gather facts and resources. It's very important for you to have the right knowledge and the information with you when you're having these difficult dialogues. All right, let's jump into the discussion. So when you're having the discussion, we are going to use all the skills that we've learned thus far, thinking about the active listening, the reflective listening. So helping while you're having the discussion, helping to label the emotion, So it sounds like there's some fear there with taking this medication. Or there's some, it sounds like you don't trust what this doctor is saying about this situation. So label, when you hear kind of, we start with the active listening, and then you see, based on what they tell you, you use the reflective listening to identify, digging deeper, to identify what that emotion is, to understand deeper what exactly is going on. So labeling that is really important. It helps it bring it to the forefront. And then validating that emotion. I definitely understand why you would why you would be afraid. There are rumors that I've heard that, there are rumors that I've heard about that as well. So kind of validating that emotion, and using non-judgmental language. So, someone tells you something that you clearly know is wrong. Instead of just saying, it's easy to dismiss someone and say, oh, that's just misinformation, and kind of just shoot them down without understanding where that is. And, when someone's truth is their truth, it's invalidating for you to just say that's just misinformation. So, saying something like, I've heard that too, let's look into what the latest research says. So being open, helping them understand that you are, open. You're not coming in with a judgmental attitude or language, or coming in to bash their views. So this is one way we can navigate situations like this. So sometimes, when you want to lead someone to the path that is better for them, it sometimes can come up as though you are trying to influence them, in terms, not as though no as though you are trying to control their decision. And so it's very important for you to give people control over their own decisions. So instead of, some of the things that are helpful to say are things like, I respect your choice and I'm here to provide information so you can decide what's best for you and your family. So someone says something that, they've chosen to not take the medication that is going to help them, or they've chosen not to, do something that is going to be detrimental. It's still important for you to be respectful to them, and even in your communication, to help them know that, and to help them that you're still a resource that is available to them. So it's important that you don't shut them out. So you provide them with, trusted materials, like where they can get more information, and you offer follow-up conversations. And even as you are providing that information, it's important that you don't just shove it down their throats, but it's important for you, even the way that you communicate, to give them that information. You offer people the information, and if so that they have some control as to whether they will take that information or not. But also offer yourself up for follow-up conversations, and oftentimes it's more than one conversation that's going to change someone to have a change of opinion. And so, concluding these difficult conversations by saying things like, I appreciate you talking with me today. If you have questions later, I will be happy to talk. So thank someone for even just engaging with you. It's emotionally exhausting when you have a conversation with someone who doesn't have the same opinion as you. It does engage us emotionally. So it's important to appreciate someone for taking the time to engage with you, and it can help foster future communications on the topics. And as we wrap up, let's get into how to connect the clients to these resources. So finally, it's important, as part of your role as a community health worker, is to help clients get these resources. You're the intermediary between them. And so it's important for you to know the resources that are out there, so that you know how and where to connect them. I put here some information here on resources that are some of the resources, but I'd encourage you to dig deeper, especially for each client that has their own individual and unique needs. You would need to do research and find those resources that are catered specifically to them. So these are some of the resources about healthcare centers that offer low cost or free health services, and free screenings by the American Heart Organization. We have information on mental health and crisis, substance use help. Um, we have information on food assistance programs, like the SNAP or WEEK, and then we have information on housing support and getting help with paying utilities and energy resources. So these are just a few. I'd encourage you to, get specific information for example, specific to medical conditions, be it diabetes, be it high blood pressure. Like there's so much information out there specific to the client. And so when you find that information, you are in a better place to help be the help individuals get access to that information. So as we wrap up, this is a final, our last slide, but I'd like you to just take a moment and reflect. Think about one thing you've learned this week through this session, but also one thing that you will practice this week. And, just one small action that you can do to practice communication. What can you do to improve your communication skills this week? So we'll take just a few minutes to think about that and write that down. Okay, well, I hope that has been helpful to you, and I hope you have learned something from this information. I thank you for taking the time to listen to me. I would like to, those are my references that I used for this presentation, and I would like to thank Kamaile for her contribution to this presentation, and I do hope that these skills are helpful out there in the field. Thank you and have a great rest of your day. Bye-bye.